Hi, this is another knee moment from Knee Fit in 5 and MSM Products. I'm Dr. Matt Lawless.
And I'm Scott Johnson, physical therapist.
Scott, I would like to talk to you today about a letter that we had written in from John, who was getting ready to do a total knee, and we talked about some of the preoperative stuff he could work on. But you also mentioned that you teach a pre-op class.
Yes.
Can you expound? You talked that you tell the patients what to expect during their total knee. What do you tell them?
Well, obviously we talk about what to expect during their hospital stay and the fact that physical therapy is going to start immediately. We're going to start initiating mobility and exercises right away. They usually spend the night and we see them the next day before they go home, and we're making sure that they can get from point A to point B safely. And of course we're focusing on their exercises with them. But the biggest thing I'm focusing on with our total knee replacements is two things. We want them to control their swelling, and we want them to get a knee that fully straightens and fully bends. I can't emphasize it enough to them. We talk about the things that they can do to keep their swelling under control by elevating, icing, compressing their knee, limiting the amount of time that their legs hang down. They're not on bed rest by any stretch of the imagination, but the longer their legs are down, the more their knees swell on them. And we've learned that if their knees swell up on them, number one, it's painful. It's very difficult to bend and straighten the knee, and it shuts down the muscles around the area. So we're really focusing heavily on keeping the swelling under control. And then their exercises are primarily focused on getting the knee to fully straighten so that they don't limp, and getting their knee to bend so that they can go back to doing the things that they want to do again.
Interesting. So you said a lot of patients spend the night in the hospital. What about the ones that go home the same day?
Yes, we do have a percentage of patients that go home the same day if they're healthy and they can get from point A to point B safely, and they understand all their do's and their don'ts and their exercises. Then we feel safe enough to allow them to be able to go home, and they do well.
Good. So to recap what you said, essentially you're telling us, and something I completely agree with, is that the important thing with a total knee replacement, get your motion back, get your leg control back, and make sure you don't swell. Keep it elevated, keep compression on it, and minimize the swelling to optimize your outcome is what you're saying.
Absolutely. Strengthening exercises are important, but for the first couple of weeks, the foundation to a successful knee replacement is really to be able to fully straighten the knee and fully bend the knee.
Gotcha. Well, thank you for your input. That was very helpful.
You're welcome.